The number of new infections of COVID-19 in children continuing to increase. According to the American Academy of Pediatrics and the Children's Hospital Association, over 88,000 new pediatric COVID-19 cases were reported just last week.
But locally, that may not be the case. 18 News reporter Tara Lynch is live in the studio with more details on that. Tara?
Good evening, Zach and Jordan. Nationally, there was a rise in COVID cases among children, but local health experts are not that concerned about it here. Regionally, we are not seeing this trend, but health experts are still cautious about the future.
Some children do get seriously ill and some have died. So that's avoidable, and you don't want that to happen to your child.
The American Academy of Pediatrics said there's a spike in COVID cases among children. Although a high point was reached in mid-January, it is on the rise again.
As the virus spreads, it is more capable of infecting children, if that's what's happening. Then you will see more sick children, unfortunately. And the explanation of why some children are more susceptible than others is another one of those unknowns.
In the Twin Tiers, there has not been this increase, partially due to our smaller population size. And severe disease like the rare heart condition developed in some children has been minimal.
Those cases, or even people being evaluated for those cases, has been exceedingly rare.
Health experts are optimistic about getting kids back in the classroom full time.
We also have much more robust testing for screening people in the first place. So it's a really different dynamic, and I think there's no question that we're going to be able to open schools safely.
Many specialists believe that getting kids vaccinated is one step closer to reaching herd immunity.
You know, if you want to stamp this virus out, you have to stop the transmission chains as early as possible, and that means vaccinating as many people as possible so that the risk of transmission to someone else is broken.
There's a lot of optimism that our 12 and up patients, kids, will be able to get vaccine this year.
Dr. Hevner also said it is important to make sure your kids are vaccinated against other diseases like tuberculosis, diphtheria, and measles. These experts say that the COVID vaccines are safe and effective. Live in studio, Tara Lynch, 18.